And welcome back to This Week. I'm pleased to be joined by Kelly Insana. She is the Vice President of Marketing and Communications for the Tennessee Hospital Association. Nice to see you.
Nice to see you, Bob. Thanks for having me.
We're talking, sadly, about hospital losses here in Tennessee. A new report from the Center for Healthcare Quality and Payment Reform found 734 hospitals nationwide, representing about a third of all rural hospitals, are in danger of closing. 309 of those hospitals are at imminent risk of closing. Do those numbers surprise you, concern you?
They don't surprise me, but they definitely concern me. This has been an ongoing issue, and COVID-19 pandemic really exacerbated it. So it was kind of the perfect storm of many things at once. We were already having issues in rural healthcare. In fact, THA for years has had programs for incentives to get providers in rural communities and other underserved.
Have those been successful?
They have, and they continue to this day, and we have added to them since the workforce shortage after COVID. So workforce was a huge issue. And a lot of people don't know this. Hospitals have gone through a very significant financial crisis post-COVID. There was a time in Tennessee after COVID that 50 to 60% of our hospitals had negative margins, meaning they operated at a loss. So clearly that's not sustainable. With those reports, I see those types of things come out. They're good awareness to say, you know, we need to continue working on it. I think sometimes people tend to think it means, even though you said it, that, oh, they're likely going to close.
Right.
It's more like there's a concern. We need to watch this. The path they're on right now.
The imminent ones are the ones that are real concern.
The path they're on right now is just not sustainable.
Here in Tennessee, 17 hospitals are in danger of closing. 12 are imminent. That's a big number. That's roughly 10% of all the state's hospitals are in danger of closing. Are we at a crisis level in this yet?
I don't think I'd use the word crisis. It is definitely something we're watching, and there's concerns, and there's things we're advocating for to help stave that off and try to keep hospital presence in our rural communities. As you probably are aware, Tennessee is the second in the nation for hospital closures since 2010, behind Texas.
Right.
But if you look at it per capita, it's actually number one, because Texas has far more hospitals than Tennessee. So it's something that we have been dealing with and we have been working on. And the word I used before is the word that is important. It's sustainability. How do we mix our...
You don't want to place blame. You want to look at solutions. But what is the cause of this? Obviously, hospitals have to make money. They have to pay for the drugs and the doctors and the physicians. They've lost some Medicaid funding. They've lost incentives to Obamacare. They've lost patients who have lost their health insurance. So all those result in free hospitalization payments. The hospitals can't say no. Is there one key element that's causing this lack of funding that these hospitals are saying, we want to provide care, we just can't afford to do it?
I guess would be nice if it was kind of one thing that we could focus on. It really is a lot of those things you mentioned and other things. The first one is, especially in rural areas, hospitals run with extremely small margins. So a lot of times the money they're bringing in is just barely covering expenses, and then a lot of that money is having to go to rising costs. So that's something that we've all experienced as well. So that's a big driver as well, is just the cost has gone up. We also, as you touched upon, the money coming in, we have the majority of our payers are either government payers or commercial insurance. The government payers aren't paying the full cost of care at times, and commercial insurance is better, but we've seen more and more what we call administrative burden, which is like red tape, that can cause some delays and underpayment and a little bit of a barrier to care.
What this results in, and we're already seeing it, is hospital deserts, healthcare deserts in Tennessee, specifically rural areas. And if you lose 12 more hospitals, you only create more of these deserts. And that results in what? Folks in communities that maybe had a place to go, don't have that place to go, and now they're an hour and a half, 2 hours away from a hospital, and that number of people in that predicament continues to grow.
Yeah, and that's a real concern. I mean, that is the number one concern, is are the communities getting the care that they need? And that is hospitals' mission. And so that's one reason we're watching this, but exactly what you said is what happens. People have to go further for care, and sometimes they forego care because they don't have transportation, or they have to take off work and they don't have the time to do it. And then sometimes you're in an emergency situation, and those minutes matter. And so that's why, as you stated, it's better to have them within a reasonable distance than making the local hospital further and further away.
Just 2 years ago, this is a real example of what's going on in Tennessee. The Jellicoe Regional Hospital in Jellicoe, Tennessee, small community, community. It now sits abandoned. It shut down on March 30th, 2024 without any notice. These folks it was suddenly closed. It was built by a nonprofit healthcare provider, but in the 70s to serve this with what's a coal mining community. Ownership changes and the like, and it turned out to be unsustainable. Now, 2 years later, they still have no health care. And this is the story that's kind of repeating over and over again in rural parts of Tennessee.
Yeah, in the country, in a lot of ways as well. That is correct. I mean, it can be devastating to a community, not just that they lose their healthcare presence, which is so important to the health of the community, but there's also down the line economic impact as well. Tennessee hospitals employ about 114,000 individuals, and a lot of times in those small towns, it is the largest employer of that town, and it creates other businesses because we have more people there, and they going to visit somebody at the hospital, they might be going to the local cafe for lunch.
Some shocking statistics. Since 2010, besides Jellicoe Regional Hospital, the Cumberland River Hospital shut down in 2020, Decatur County General shut down in 2020, Jamestown Regional Medical Center shut down in 2019, Tacoma Regional Medical Center shut down in 2019, McKenzie Regional Hospital 2018, Copper Basin Medical Center 2017, Tenova Healthcare in McNairy County 2016, United Regional Medical Center 2015, Park Ridge, that's Nashville, shut down in 2015, Gibson Hospital and Humboldt Hospitals, both 2014, Star Medical Center 2013, Riverview Medical Center in 2012. 15 hospitals in the past 15 years.
Yeah, we're number one per capita.
And you mentioned this, it's not just Tennessee, nearly 46%, almost half of all rural hospitals are at least in danger of shutting down, if not imminently closing because of funding concerns.
Yeah, funding is the key word there. It goes back to that sustainability piece. So the ways that we are funded change over time. Costs have gone up. Like everyone, I mean, we know how costs of gas and eggs have gone up. That healthcare is not immune to that. And then in some cases, we have to be aware it is changes within the community.
Right.
That sometimes maybe the community doesn't have enough of a population.
If they lose an industry, maybe they lose some population.
Correct. But at the same time, it is that economic engine at times. So sometimes they can't grow unless they have that healthcare presence there, because people, may need it for whatever medical reasons they need to have something.
It
nearby.
does. Sadly affect the least of us most of the time. It's rural areas, usually lower income areas. I know you're working hard to see that this doesn't happen and to keep these hospitals there. Is there a way to work with folks who recruit jobs so that you try to get an industry into Smithville so they don't lose their hospital that's already there? I mean, I know these are complicated issues. How do you approach this to try to save as many as you can? Yeah,
obviously that is a big function of what THA does. So funding is that key piece. So a lot of what we're doing is finding ways to address that unpaid care or underpaid care. For instance, we worked over the past few years to Medicaid traditionally underpays. So we worked with state officials, federal officials to put a program in place that helps kind of backfill that cost to the hospitals when Medicaid isn't able to pay the full cost of care. Medicare does better, but Medicare Advantage is a problem. It's not meeting full cost of care. So another thing we're doing is working with people to make sure that they understand that there's two options available. But that there's trade-offs. If you choose one or another, that it's not just what's being marketed to you. There's some trade-offs for the Medicare Advantage program. And then also, we haven't gotten into this, but there's some federal cuts coming starting in 2028. So that's something we're working on right now, is how do those federal cuts, how are they going to impact Tennessee hospitals, and what can we do to try to mitigate that as best as possible?
Kelly Insana with Tennessee Hospital Association, you do the Lord's work. You're trying to save these hospitals, and it's not easy. Appreciate your time and your insight.
All right, thank you, Bob.
Stay with us. This week continues in a moment.